This presentation is for Intro to Sonography Class 5. We're going to be talking about what it means to be a profession and all of the acronyms that get used in the profession of sonography. As you can see by this wordle here, we often refer to this as our alphabet soup. We have a lot of acronyms because we are a very diverse profession with multiple credentials, multiple credentialing organizations, multiple professional societies because of the number of specialties that we encompass. So here are our objectives. First, we're going to talk about differentiating job versus career and best practices for patient satisfaction in this presentation. So I want you to reflect. Why did you choose to inquire, apply, and enter into the sonography program? What was your catalyst? How did you first learn about sonography? What intrigued you about sonography? Was it thinking about babies? Was it thinking about vascular? Was it thinking about helping others and giving back? Was it about the salaries that you may have seen on, some of the websites? Was it because you wanted a career change? Was it because you have friends that are in the field? So think about what brought you into the program. And was it more self-serving? Or was it out of it's better to give than to receive? Often it is a combination. There's not a right answer or a wrong answer. Often it's a combination of reasons. What should be the ultimate goal for entering into sonography? It's not always about the money. Yes, it is important to be successful, to be able to earn what you deserve because of the level of responsibility a sonographer holds. But it's not about making money if you're not happy with your choice of what you do each day. You want to be able to get out of bed with enthusiasm and challenge the day forward. But the ultimate goal needs to be about the absolute best patient care and diagnostic outcome for performing that exam. This isn't about one of the patients of the day. This is about each and every patient, each and every day. You need to be attentive. You need to be cognizant. You need to re-energize sometimes from job burnout. You need to think about ways to make that job or career, where we're going to talk about, how can you make it stimulating for you? We all have different needs, but we have to make sure that every patient gets our full attention because of our education, because of our knowledge, and we need to keep on top of the latest trends, technology, whatever that might be, because we are the first responder to that patient. We might not be providing that emergency care, but we are the first responder of obtaining that clinical history, of performing that exam, finding those sonographic appearances, formulating a preliminary diagnosis, kind of analyzing, proving that diagnosis before we send those images to the interpreting physician. So which one describes your goal? Do you want a job or do you want a career? So looking up the definition of a job is the regular work that a person does to earn money, or a group of homogeneous tasks related by similarity of functions. So that's a job. Is that what you want day to day? Is that why you came into the program? Because you wanted a job, a regular work, a group of homogeneous tasks, the same thing day after day? Or did you enter for a career? It's a job for which you are trained, and I would prefer to say educated, and in which it is possible to advance during your working life so that you get greater responsibility and earn more money. Is that what you want? Do you want a level of responsibility over others? Do you want to be an educator? Do you want management? Do you want maybe something with quality assurance and quality improvement? Do you want to maybe move into a different branch of healthcare by being proactive? Another definition is the progress and actions taken by a person throughout a lifetime, especially those related to that person's occupation. And so it is a progress in actions, but if you treat the opportunities as homogeneous tasks and only do what you are expected to do in that 9 to 5 or 11 to 7 position, and you come in with an attitude of, you know what, I'm putting in my day's work and I'm out of here. And there's nothing wrong with that. But you also have to recognize that that is what you might be doing for several years. Versus, you know, can I say yes to an opportunity when I'm presented? Can I invest a few more dollars? I'm not talking now as a student, but can you invest some dollars and attend a national conference and learn what the latest technologies are, as opposed to the webinar? Can you go to the exhibit hall and learn about and see the equipment and see what's out there, as opposed to what's in your facility and what someone else says you're getting? Which one is it that you really want? If you choose the job and your coworker gets promoted, do you have any right to be envious? Do you have any right to complain? Remember, we all make choices. We have choices and we make choices. Sometimes we don't get the opportunities for choice, and particularly in immediate, but small baby steps that prepare you for something different can then bring that opportunity, and you're prepared for that opportunity. So attitude, this is something when I was looking up the word job and career that came up, and it's from Urban Dictionary. And so job says, in this quote, means by which at least 30% of your life is stolen away from you to enrich the owners of a company making useless products that some other poor idiot in a job will buy. And while I completely disagree with that statement, I've heard those statements, and maybe not verbatim in that sense, but I've heard them in regards to certification that we'll be talking about. Well, why should I get certified in every specialty that I perform? I'm not going to make any more money. It's, you know, the ARDMS is only in it for the money. They don't care about us. Why should I get those? I'm only going to have to get recertified. You know, if all I need is abdomen and I can do vascular and OBGYN and breast and, you know, MSK, and, you know, the only thing I need for my job is abdomen or one of those, then why should I do the others? You know, I want a personal life. I want to be able to do things. Well, you can. It takes some time out to study for those exams, but once you have them, you are enriched. First of all, you're enriched with knowledge. It makes you a better sonographer in your scanning techniques, and you are being proactive if you want a career. But if you want a job, I will share with you, you will burn out much quicker. And so career, which I thought was kind of interesting, was similar to a job or work, usually means that you're stuck at the same pay level that you start with, no chance for advancement, and that someone else will pass you for a promotion, even if they're less qualified. Also usually requires a piece of paper that you spent thousands of dollars on, which you will never make back. Again, attitude. Is this a good attitude? Absolutely not. First of all, they probably aren't getting promoted because they can't type or spell. It is poorly written. And they rationalize it with an excuse as opposed to being proactive. So while they're making these comments, somebody else is out there learning how to use Excel or maybe PowerPoint or, Prezi, a different presentation, giving a presentation. That's a scary thought. I never thought I would be presenting nationally. Still not something I seek. People ask me now. I don't know why, but they do. And so it's not something I ever planned when I got into the field. My field, when I got into it, was about healthcare and helping patients. But I started to lose focus. It wasn't I was treating it as a job. I wanted a career, so I wanted to be stimulated. And therefore, I made a lot of my own opportunities. But I also said yes to other ones. So think about, in moving into a career, if that's what you want, or a job. So which group might be going for a job, and which one might be going for a career? So keeping in mind that you are working with different generations. There are lead sonographers, sonography supervisors that, I'm going to be honest, are more about my age. We are a different generation. Doesn't mean we're right, doesn't mean we're wrong. We're just different from the, from the baby boomers to the Generation X to the Generation Y. So there are different generational differences. Culture, society has changed greatly from a more formal society to a much more informal society, and that's fine. There is a place for informal, but there's also a place for professional dress. And I often feel, and it's a personal, but I often feel the way you dress is a reflection of self-esteem. Not always. I love my sweatpants. I love my sweatshirts at home. Going to the gym, walking, going for a walk, there's appropriate reasons for them. But when you are thinking about a reflection of yourself and you're out in the public where you might see your clinical instructors, maybe the lead supervisor that someday might be your interviewer, what type of a presentation do you want to give? One that you're motivated? One that you're slumpy, maybe, lazy, I don't like to get out of bed. I get out of bed, but I literally get out of bed and move into the car because I don't have time for a shower. I don't have time to get out of my pajamas. I come in my house slippers. Is that painting a good portrait? And I'm talking even at the grocery store, the mall, where you might run into maybe the imaging manager. And if you're scuffing around in pajamas and house slippers, at noon on a Wednesday, think about it. And it's not that it's a right and a wrong. It's about perception. And perception creates some problems sometimes, and judgments, which probably should not be there, but it is. Certainly the, school kids here, the college kids here, through the halls with their pajamas, the ripped knees. And again, I recognize this is style. Okay, we've got a leopard suit back here of some sort. Again, I'm not saying there's anything wrong with that, but think about your self-esteem. Are you alert? Right? If I need to stay alert, I cannot be in my jammies in a comfy chair. That's not going to make me stay alert. So think about the dress. You want to be positive thinkers. You want to be energized. Again, make sure, you have a friendly smile all the time. It's all about sometimes hiding those true emotions, those true problems when you're in clinic. Again, this dress is very appropriate for certain occasions. Certainly not for an interview. You would not go in an interview with this. And while some might say, it looks pretty, classy and dressy, you have to remember generational differences. Who are you interviewing with? Okay, what do your patients think if they see this, if you are coming through the hospital? Again, some might go, wow, very snazzy. Other ones might go, wow, I hope she's not doing me. And again, I'm not saying it's just the way people think because of generational differences. So my recommendation is to play the happy medium, somewhere in the happy medium. Okay, and so it's not formal, it's not, being completely informal, but something in the middle, something comfortable here. Okay, when you're in class and you've got a blanket and your gloves and, are you really, comfortable? Well, yes, maybe temperature-wise, but what about self-esteem? And I know the rooms get cold. I'm not saying that. I'm just asking you to think about, where is your mind when you have the blanket? Probably you wish you were somewhere else, right? And so think about, how does it make you feel when you're dressed a little bit nicer versus when you're in your, pajamas? I think you find yourself having a little more self-esteem, maybe fun, positive energy, as opposed to when we have these, down times. And again, it's about you don't know who you will run into out in public. And same is true with Facebook. And I'm not talking about these images. But, if you have this image on Facebook, could it create different perceptions? Maybe. Maybe not. Add a glass of wine to that, or a bottle of beer to that. Would it create a different perception? Same way if it was in his hand, right? Except simply wouldn't have the box. But let's just say it was in his hand carrying the box, right? Not a good image to be on social media. Some nonverbal communication and appearances. Okay, remember, you're representing the profession. You're not only yourself, but you want to represent the profession, because sonographers don't get a lot of respect for the knowledge and the rigor of their programs. And so we have to be that catalyst of change and educate others that our programs are not easy programs. We have more clinical hours than most healthcare programs, and that includes, 3 years of graduate work for some professions. You will have about 1,500 clinical hours. Nursing programs have 800 to 900 hours. So you have, not quite double that. You put in a lot of time. You learn a lot of pathologies. We write preliminary worksheets, almost a diagnosis. We need to communicate that out there, that we hold a lot of responsibilities. But when we come and dress, in hoodies, and I'm not picking, but, again, appropriate time for hoodies, but not when you're giving a presentation. Okay, not when giving a presentation, not when you're in the clinic setting. Hoodies are not professional. They get grimy, they often don't get washed, they are not professional. You have someone else, if you were doing this in front of a patient, would you not scare the patient? And maybe this girl has a headache. Maybe she's concerned for the patient. Maybe she doesn't feel good. Maybe she's angry and upset about something. Same way with this one. Do not sit in the halls in the hospitals. Okay, so appropriate behavior, this nonverbal actions, positions says a lot. This individual, do we think she's being professional? You know, look at her nice straight back, an ergonomic chair, an ergonomic band, you know, sitting nice and straight. You know, she's got a smile on her face. That's professional appearance. She looks like she's enjoying what she's doing. T-shirt products. Does this t-shirt or this one, okay, so does this t-shirt or this t-shirt represent the profession well? Is that how you want the public to think of us as a sonographer? We have a job ahead of us to educate the public. We certainly don't want some vulgar on our back. That does nothing to help the profession. And if you want the salaries, if you want to maintain those salaries, you have to treat this as a profession. Otherwise, it can be a $9 an hour job because anyone can do it. You know, we need to protect what we have because only sonographers know what we do. So think about nonverbal communication. When you're scanning and the patient says, "Can you tell me what you see?" You know, your response is, "I'm sorry, I can't. It's up to the physician to read them." And the patient will say, "Oh, I know you know what you're looking at. You know, what's your response?" "Oh, I'm just the picture taker. I'm like a photographer. I only take the pictures." Is that all you're doing? If that was the case, you'd be done by now. At the end of the semester, you'd be done, but you have another, 15 months to go to learn how to scan, to learn all those pathologies, to learn how to describe. Critically think, how does that clinical history work? You have a huge level of responsibility. Do not diminish that by calling yourself a photographer or just a picture taker. So what should we be called? I'm sure, just like the t-shirt, you're going to see ultrasound technician. I'll give you a piece of advice. Don't ever put it in a written paper that you submit to me. We are not technicians. Are we a technologist? Better term. It is what the public knows, an ultrasound technologist. Or are we sonographers? And diagnostic medical sonographer. So we're going to ask you to research each of these terms and how does the roles and responsibilities of a sonographer fit into these three categories. So think about your goals. Where do you want to be in 5 years, 10 years? I know where you want to be in about 16 months. That's completing the program. But what about after that? Yes, I know you want employment. I hope that comes true for you. But how are you going to be sure that you are a qualified candidate for employment? Is it about earning A's in the courses? Is it about, good clinical scan skills? Is it about proper behavior, optimal communication skills? Or is it, a combination of some of those? And it is a combination. Not everybody is A and, an A student and, wonderful in clinic and has the scan skills. Everybody has an area of strength and everyone has areas for improvement. They're not all the same for everyone. And so you will find your niche of where your strengths are. And that's great to have them. But where do you need to concentrate? The areas that need to be improved. Maybe that is a particular course and its grades. But what is so important is asking for help, finding a different resource or some in the library. But what about after you finish the program? Do you want a job or do you want a career? If you want a job, likely you won't join any professional societies. You'll figure a way of getting your CMEs. You might even join the society and copy the answers off of somebody else. You don't want to do anything beyond what your scheduled shift is. You don't want to invest any personal dollars into it. If the job will buy a book, that's fine, but I'm not going to buy a book on my own later on. And again, it's not to say there's a right and a wrong for that, because sometimes finances don't permit. But there are free internet resources. Read them. Join a professional society. It's your biggest bang for the buck, if you want to call it that. I will share, I never thought I would be an educator. I didn't set goals for myself. But I also knew I needed to be educationally stimulated. That I didn't want every day to be the same. And so I did say yes to opportunities. So back to the ultimate goal, and that is the patient. And when you have a positive attitude, when you enjoy what you do, when you truly enjoy and find the passion for what you do, and that comes with time. It's not now. It hopefully will come with time for you. But when you have that, you recognize that the reason we are there is for patient satisfaction and patient outcomes, quality imaging. Come to the simulated lab. Practice. You don't have it down yet. Time is flying by. If you haven't done left kidney and spleen, practice it. If you haven't done thyroid, practice it. If you think, well, I don't know what else to learn about the abdomen, be proactive. Scan thyroid. Scan the left side. They're not easy. Work on your intercostal scanning. There's always things that you can improve. Change your focal zone, frequency, equipment. We need to optimize those images for the patient. Remember, we are the front line. So over the past probably 5-6 years, patient satisfaction has really been on the top level of concern and prioritization for healthcare facilities. And so hospitals send out surveys randomly to their patients post-treatment, including outpatient diagnostic testing. Patients are asked a number of questions and they must answer on a scale of 1 to 5. There's also space for comments. Keeping in mind that some of these survey results get used for employee performance reviews. Determination, will they get the full 3% or only part of the 3%? Sometimes it's used for managers. Is the manager of the department, managing their employees effectively? And again, dissatisfied employees do not do well for patient care. It is seen by the patient, whether it's in verbal communication or nonverbal communication. You need to, ask the patient when they come, how are you today? Do you have any questions before we begin? Explain the exam. At the end, anything else I can do for you today? I know it's scripted language, but it is what's expected. And you might say to yourself, well, I'm a student. Why does this affect me? Because you are part of that department. Yes, you are a student, and that's where you are on the organizational chart. Okay, you're not really on an organizational chart, but that is your role. But you also have to act like an employee. And if your bad behavior gets reflected on that patient survey, it's coming back on the stenographer. And if the stenographer says, you know what, that's all about the student, then there's going to be a conversation. So your behavior, your communication will get equally reflected on that survey. It's not going to get reflected as the student. It's all about the experience. So some websites, and the reason for this is healthcare facilities are required to conduct patient satisfaction surveys, and there's some links. And an example of a company that creates and administers these surveys is called Pressgini. The surveys are scored and then posted publicly on the internet for everyone to see. We can compare hospitals. Every employee is held accountable for the scores of their department as part of their performance evaluation. And so you can compare hospitals. So in other words, consumers could shop around, and hospitals are in competition with each other. Have you comparison shopped? Or do you think wherever your physician sends you, that's where you need to go? Be a smart consumer. And remember, you're part of the team. Clinical sites are contracted. They do not get paid anything to work with you. And they can withdraw that contract at any time. They are the most valuable resource for healthcare programs, and certainly for this one. If there is conflict within a clinical site, either Karen or I will talk to the student, we talk to the clinical site, and try to determine how we can resolve the situation. If it cannot be resolved, then you will be removed from that clinical site. Regardless, I'm not saying it's your fault, but for some reason it's not working. However, if the same behavior and problems occur at the next clinical site, if there's one available, then likely it's you or something with your behavior. And therefore, action will be taken. We typically do not have this problem. Often, at one site it might be a little bit of personality differences, and the second site works out. But it's not a guarantee, so you have to be observant. What is the behavior of that department? What is the culture of that department? And then think about bad behavior, intentional or unintentional, is a poor reflection on the student or you, on the staff, and can ultimately result in negative short or long-term consequences. The patient must always come first. That's why you chose this career. If you did not choose it about the patient, and you chose it for other reasons, you need to think twice. Again, there's benefits that come along with it, certainly money, sometimes job security in healthcare, but ultimately you're there for the patient. And professionalism must be everywhere. So some key points to remember. Always introduce yourself to the patient. Ask them their name, the two identifiers, before you even ask them clinical history. Make the patient aware that you are a student. ask permission to observe or to scan the patient. I will share that each facility where students are assigned do this differently. So be observant and let the sonographers take the lead on how they introduce you. Some like to minimize the studenthood. Some call them interns. Most patients will allow students in the room and students to scan, but you will have some patients that do refuse and ask you to leave the room. Do not take it personally. That is their right. However, if a lot of patients are doing it, maybe it is something that is, a very first sight, first opinion. Respect the patient's privacy, explain the exam to the patient, and then when you're done, wipe the gel off. Don't let them initially. Help them up off the table. Thank them and ask them if there's anything else that you can do for them today. This is important. You want them to know they're welcomed, and you want them to know on their way out that you appreciated their business.